Hello, this is Dr. Jerry Morris, and I'm here to talk to you a little bit about treatment planning. Of course, this is one of the most dread duties of most mental health professionals. However, it is also one of the most exciting interventions in our cadre of skills. Treatment planning should be looked at as a technique or therapeutic intervention that has many things involved in it that are constructive and helpful in facilitating change in the patient. One of the first things that we notice in treatment planning is demonstrating to the patient that psychotherapy and counseling is teamwork. In other words, it's a joint project between the expert and the patient in order to understand them, identify their input called client-centered approaches, and to try to see what they want to fix and add our expertise to help them change or fix things. Now, in that sense, it is a way of starting a bonding or a relationship in which the patient feels valued, respected, and in which they feel like their input is always welcome. That's a major therapeutic accomplishment. Next, the treatment planning process is a way for us to coordinate care with a lot of different specialists and people with a lot of talent that can help our patient. If we're a primary therapist or the person coordinating a case, it is a chance for the patient and the therapist to evaluate the notes, the input, the skills, and those things which the patient has experienced with other members of an interdisciplinary team that they think are working and not working, and to begin to coordinate those services. Additionally, a third aspect of treatment planning is contracting, engaging the patient in making a commitment to certain goals, objectives, interventions, and knowing their responsibilities in that work and in accomplishing those goals and objectives through a commitment to participate in those techniques. So you can see that the treatment planning intervention is truly a therapeutic technique or intervention that also ends with updated assessment and renewed commitments to the contract of growth and growth facilitation between the patient and the therapist. Now let's talk about some of the components of an effective treatment plan. First of all treatment planning comes from goals that are developed from assessments and problem lists, so that when the patient and the therapist evaluate the intake and advanced assessments, they are always looking to develop a problem list, and out of that to consider some goals. Now, goals should be understood as hopes or wishes or fantasies. These are overarching, broad items that the patient and the therapist and the team agree upon that they hope someday to achieve. Second to goals are the objectives. These are pathways or the kind of steps that we will agree that we will all take that will lead us toward our goals or start to move us toward achieving our goals. And then finally, the third tier are the techniques or interventions that we apply to the objectives that we hope will help facilitate achieving the many objectives that are under a goal that will ultimately get us to this hope or dream that's a long ways away that we call a goal. Now, of course, the interventions or techniques will also have a professional attached to them that is responsible to implement, monitor, and adjust those techniques and to chart them and provide feedback for the other disciplines on the team about how the work is going using that technique to achieve an objective. And ultimately, a lot of objectives can move the patient toward their goals. So it sounds complicated, but it's really not. There are three things. There are dreams or hopes or wishes. We call those goals. These are broad things. They come from the treatment plan and assessments and problem list phase of developing the treatment plan. After the hopes or dreams, we have objectives. These are paths toward those goals, and there may be many objectives under a single overarching goal. And then for each objective, we should have one or more techniques or interventions that help the person achieve the objective, and who is responsible for guiding that technique or providing that technique or measuring the effects of that technique. So, for instance, let's take an example. Say one of our examples would be the wish of the patient and the family that they could break down their habits of drinking alcohol daily and achieve sobriety. That would be an overall wish or dream or goal. Under that, we could have several objectives along the way to creating that commitment to sobriety and ability to carry off sobriety and to have that as a goal. So one of them may be that we would attend individual substance abuse counseling with therapist A, which would be the intervention for an objective of engaging in processes that will help us maintain a commitment to sobriety, break down denial and projection and rationalization. So we'd have the overarching goal of achieving sobriety and the motivation to keep and maintain sobriety. We would have the objective of attending those functions that would help us to keep our motivation and our focus on this goal of sobriety. And the intervention would be individual substance abuse counseling once a week with therapist A or B. Now, another objective under that same overall dream or goal might be to attend AA twice a week and bring back notes from a sponsor showing attendance. And so that objective would be under the objective of maintaining and engaging in those behaviors which helped us stay motivated to be sober. And then the intervention or technique would be 2 AA meeting attendance documented a week and brought to our individual therapist A. Another objective under that same goal could be to receive encouragement from family members positively instead of defensively. And one of the interventions for that objective under the sobriety goal might be family therapy once per month, in which we work on maintaining openness to feedback from our family and see encouragement and cueing as a positive thing rather than resisting it, getting angry, or seeing it as a negative thing and rejecting it. A third objective under that goal of achieving and maintaining the motivation and behaviors for sobriety might be to participate in the kind of honesty and openness to have people check up on us. So then the intervention might be one urine screen at random every 10 to 20 days. It might be coupled with the ability to survey the family members with phone calls to get direct feedback on sobriety and to sign a release to do that with family members. Another objective for achieving and maintaining that goal of sobriety might be allowing the program to refer us to one of the program or other collaborating physicians to provide medication management, which would help with inhibition to use alcohol, and then the intervention could be the physician prescribes and monitors acamprosate, and we have the name of the specific physician responsible for that. Another objective under the same overarching goal might be to engage in positive, sober support systems and activities that are a deterrent to using, and under that objective, an intervention might be attending church on Wednesday nights and Sundays, or enrolling in a Wednesday night baking class, etc. So you can see that it's a tiered process that starts with a dream or a wish, like the wish that I will achieve and maintain sobriety and the motivation to do so. Lots of objectives in doing that, or paths to achieving and maintaining that sobriety. And then at the objective level, we go down to the intervention level, and lots of people and disciplines and places and things to help us to achieve each of those objectives that will move us along the path to our dream or goal. This is Dr. Jerry Morris. I hope that this has helped you at least conceptualize both the importance of the intervention of treatment planning, which should be done with the patient once a month. It should be set in the frame that this is a technique or intervention, just like working on triggers to relapse or cognitive behavioral therapy. It's a chance for us to get input and teamwork going between the therapist and the patient. It is a chance to do updated assessments, and it's a chance to find out what works and doesn't work for the patient and adjust to those things. It's a chance to contract so that the patient knows their roles and duties and expectations and commitments, and the therapist and the team know theirs. It's a chance to advocate for the patient and provide leadership in that technique of treatment planning to see if all of the members of the multidisciplinary team are providing the techniques that they're assigned and addressing objectives and how they're doing in that. So treatment planning is an exciting intervention, not just a duty or a requirement, in the treatment of professionals and in the treatment of their patients. So you should be excited about your chance to sit down with your patient every month, or when something major changes in their treatment, and do these treatment planning interventions. Thank you. This is Dr. Jerry Morris.